Hello everyone, Assalamu alaikum wa rahmatullah. Today, inshallah, we will discuss very important topic, oncology. It's not one topic, it's module. And we will discuss two topics here, very, very important. And both of them are recent recalls. We will discuss cervical cancer and ovarian cancer. So let's start with the general template. The general template, guys, in each module will help us to know how to ask the questions and what about the important questions, less important questions, and the questions we can ignore or we can skip in the history to be very targeted history. So let's go with the template. At the start, these are the modules, and we are here in the oncology module. For the domains in the exam, for each domain, it's 2 marks each. Information gathering, communication with the patient, patient safety, communication with the colleagues, and applied clinical knowledge. So usually I'm keeping this slide in all the modules and in every presentation. Why I'm keeping this like constant in my slides? Because to know how the examiner will give you marks, this will give you alert that don't put here more effort in the information gathering, like to gather the information in 6-7 minutes, and it will be only 3 minutes to counsel the patient about her condition, to offer her the management options, to give the pros and cons of each, and to ask her what about her preferences, and to involve her in the plan, which is very important point. And you will get mark for that in the communication with the patient and also the patient safety. So to involve the patient with you, it's very important, because if you will not involve the patient and you're going to say, this is the option we have, we will give you, for example, here we are in the oncology, we will give you the chemotherapy or the radiotherapy or the surgery without asking the patient what is in her mind, what is her preferences. It's very important, guys, to ask the patient. It's part of the communication and part of the patient safety. Communication with the colleagues here in the oncology, very easy, because it's the MDT or the multidisciplinary team. And for sure, if we are in the simulated patient task, we have to tell the patient it's a group of expert team. I don't prefer to say it's a group of expert doctors, because the MDT, it's not only doctors. So you will find a radiotherapy technician with you. You will find therapist with you, pharmacist with you, dietitian, the nurse. So it's not only doctors. So I like to tell the patient that it's a group of expert team. They will sit together to discuss your case and to see what about the best option for you. But also it's after discussion with the patient. Even if you will have the MDT decision, you have to tell the patient, the MDT, this is the decision of the MDT. What do you think about that? Do you agree? Are you happy with the plan? So this is involvement of the patient. Applied clinical knowledge, yes, we have to pay attention to the applied clinical knowledge. It's not all about the knowledge, because here in the knowledge already, it was assessed in part 2. Yes, still you will be assessed for the applied clinical knowledge, but it's all of these domains, it's 2 marks. So for example, if you will stay here for 7 minutes, it's only 2 marks. And for sure, if you will consume the time here, it will affect the safety and it will affect the clinical knowledge. Okay, for the clinical knowledge, as I told you, it's already assessed in part 2. So here, what about the applied clinical knowledge? It's here how to tell the patient everything, but in a simple way. So it's part of the communication and part of the knowledge. And you will find a lot of points here, guys, there is overlapping between domains. You will not be able to say this point, it's only communication. This point, it's only safety. No, sometimes you will find communication and safety, there is overlapping. Clinical knowledge and safety overlapping. Part of the information gathering, like the important questions like cervical screening here, will be patient safety as well. It's part of the information gathering and patient safety. So my advice, and it's general advice for all the modules, take care of the patient safety. I feel like if you will pass the patient safety, you will pass this exam, because here in UK, they want a safe doctor. They They are not searching about the doctor who knows everything in the world. No, just if you don't have the information, just tell the patient, it's not in the top of my mind. I will read about it and come back to you. I will ask my consultant and come back to you. Now you are a safe doctor. Usually, I like to highlight this point every now and then. Just be a safe doctor, have the sufficient knowledge, and tell the patient this knowledge in a very simple way, and give the patient a piece of information. Ask her, am I clear so far? Are you following me? Are we still in the same page? Any question you are familiar with, you can make it constant in all the stations, but give the patient a piece of information. Ask her, am I clear so far? It's very important, guys. So this is the aim why I'm keeping this slide here. Every time I will remind you that all the domains, every domain is only 2 marks each. So don't pay your effort in one domain and leave the others. Okay, so this is these are the domains here. In any station, we have general template for all the modules. Go like this: introduction, setting the agenda, because sometimes you will find a hidden agenda. And it was recent in the last exam, around 2 or 3 cases with hidden agenda. So it's very important to know why the patient here. So for example, you are here to discuss your management plan. Do you have any other concerns? If the patient has any other concerns, okay, I will address your concerns within minutes. But before that, I'd like to ask you a few questions to know more about you. So now you get the hidden agenda. Even sometimes the patient will not declare her agenda at the start. So during the information gathering, you have to reach this hidden agenda if it presents. After agenda, information gathering, and it's different in each module, but we have like a constant questions. But in one module, I'm gonna say this here, it's vital question. It's crucial to ask the patient. It's not important here to ask this question. So we can add one question, remove one question from the general template. So by the end of the preparation, you will be expert in how to gather information in 4 to 5 minutes maximum. Then examination of the patient. So you have to examine the patient in presence of chaperone after her permission. If you have the examination, please don't examine the patient. We will come to this point in details now. Explain the condition, then set the appropriate plan, and then finish your station by giving patient information leaflet, arrange another appointment, make the essential referrals, write back to the GP if you have a letter or a referral letter from the GP. So please, guys, take care of that, because I can see that most of you will send or will say by the end, I will write back to your GP. So if we are at the start of the management of the patient, you will not send back to the GP unless you have a GP referral letter. But by the end, when we are finalizing the case, or now the patient is she's in a good condition and you can discharge her back to the community. So at that time, yeah, I will write back to your GP. You will tell him the story from the start. You got my point? But if you have a referral letter now, yeah, you have to write back to the GP. It's like a communication point, respect to your colleague that we will do this or that to your patient because you referred your patient to us and we will do this. This is the ending of the station. Coming to point by points. Now we are in the template of the oncology. Your introduction, use wherever you want, wherever you are familiar with. Here in this exam, it's not exam of fluency, to be fluent in English, or if you have like different accent, because all of us, we are not natives, yeah? So we will have our own accents. But here, the fluency, it's not like to be fluent in English. No, just to show yourself like, I have a self-confidence. I can speak with the patient in a good way and easy way and clear way. So this is the issue. So just choose wherever you are familiar with. Don't put like, this is my template. Take it. If it's easy, you can use. If it's a little bit hard, or it's even your accent or your English language is better, so you can use whatever you want, but make it constant in all the stations. So when you will go in the exam or inside the cubicle, you will be more fluent with the patient, dealing with her like in a very simple way. So you can use this or another one. So In the introduction, you can say, hello, I'm Dr. Rana, one of the doctors in the oncology clinic today. Or if you are not aware about where are you, very important point, guys, take care of that. And also it's like a safety point. I'm one of the doctors in charge today. I'm one of the doctors here today. I'm one of the doctors in the clinic today. If you cannot remember what was outside the cubicle, because usually you'll find a lot of information outside the cubicle. So if you cannot remember, we are human beings, so we can forget. Yeah. So just say, I'm one of the doctors in charge today. Don't say anything, and you will discover that you told the patient that I'm one of the doctors in the clinic today, and you are in the emergency department. So you have a problem in the situation awareness. So take care of this point, guys. It might be, or it seems like very simple point, but it's very important in the exam. So if you cannot remember, I'm one of the doctors here today. I'm one of the doctors in charge today. If you are sure that you are in a clinic, but you are not sure which clinic, so I'm one of the doctors in the clinic today. Can I confirm your name and age, please? Yeah, for the exam, use the age. Usually here in UK, we are using date of birth. And I know that a lot of you are working here in UK, but for the exam, just use the age because it will be more simple in the exam or inside the cubicle. Then after that, can I call you or can I address you or how would you like me to call you? This is the most polite question. I love this question actually. How would you like me to call you? Or is it okay to call you Anne? Is it okay to call you Margaret, for example? Like that. So this is our introduction. Make your own introduction. Take mine, make some changes. It's okay for me. Then setting the agenda. Also for the agenda, you can tell whatever you want, but make it constant. Don't change it in every module or with each station. I've gone through your notes and I understand that you are here today because you have this problem, which will be the complaint of the patient, or to know the result of your report, if we have a report. Okay, so this is the agenda. Then ask the patient, what about your concerns and expectations from this consultation today? And instead of this sentence or this paragraph, you can say, I have your notes here. Your notes here with me. I understand that you are here today because of that. So use a simple form, a familiar one for you. Then if the patient has any concerns, any other concerns, or it's the same agenda, like to know the result, to discuss her management, and take care this patient, she, especially in the oncology, she knows her condition or not, because if she doesn't know, so you have to break the bad news. Okay, and today we will have two different stations. One of the patients, she knows her condition. The other one, she doesn't know the condition. So just be sure if the patient knows her condition or not. Okay, I will address all your concerns within few minutes. But before that, I'd like to ask you a few questions to know more about you. Okay, or you can say, because this is the first time to see you, I'd like to ask you questions to know you more. Is it okay? Then we will come to safe, acceptable plan. For the concerns, I will come back to this point. If in the case notes, it's not clear if the patient, she knows her condition or not. So just you can ask the patient, very simple question. Did someone speak with you or discuss with you your results? Very simple question. You will know if someone already discussed this with her or not. If yes, so now no breaking bad news. Sometimes you will have breaking bad news about the, for example, the spread of the cancer. She knows that she has cancer, and it was before in the exam, in the cervical cancer. I will tell you this scenario. Okay, so this is how you will get if the patient knows her condition or not. Coming to the information gathering. So introduction, agenda, and then information gathering. Usually, we will start with history of the present illness. And it's constant in all the modules to have 3 slides here in the information gathering. One for the history of the present illness, and it's better to start with. So start with open question. It's better than the closed one. So can you tell me more about your problem? And please, from the start till the end, show empathy to this patient. Show empathy because it's a cancer patient. Even in the pre-malignant, yes. In the pre-malignant, because at any time, it might turn into cancer. Okay, or sometimes she has a pre-malignant lesion, but with more questions and with the histopathology, you will discover that this pre-malignant lesion already turned into cancer. So from the start, show empathy. What about the questions here in the history of the present illness? Usually, the presentation will be itching if it's vulval cancer, but even with other cancers, you can ask about it to rule out the spread, if there is any spread to the vulva. The pain, the bleeding, the lump. And we have what we call red flag signs. Okay, so in the history of the present illness, ask about the pain. If the patient has pain, so please analyze this pain. What about the location, the type, the severity, since when it started, referred or not, controlled with simple painkillers like paracetamol, ibuprofen or not, what increase, what decrease. If the patient has itching, what about the location, ulcers, bleeding, lump, increase by anything, decrease by anything, affecting your life, especially the sexual life here in the itching. Very important question. Then, if the patient has bleeding, analyze the bleeding, amount, blood clots, pain, lump. If the patient is sexually active, is it postcoital or not? If the patient still having the period, so ask her about the intermenstrual bleeding or heavy bleeding. Okay, you have to ask about both of them. The lump, if the patient, now she said, I have here a mass or a lump in the layman language. So since when you noticed that? Is there any pain with that? Is it increasing or it's like constant in size? What about the size, like roughly like lemon size, small orange size? You can use these things to know how about the extent of this cancer or this lump? Is there any bleeding or not? So ask the patient about one by one. Do you have any pain? If no, don't analyze. No pain. If yes, analyze. Itching, no, skip. Go to the next point. Do you have any bleeding from down below? No. Do you have any lump? No. If yes, analyze. So this is the history of the present illness, and you have to show empathy here throughout the station, actually, not here only, but I write show empathy here, but you have to show empathy in all the station from first minute to the last minute. Red flag signs, and we can consider this also in the history of the present illness. You have to ask about the urinary symptoms, bowel, loss of weight, loss of appetite, bleeding, pain, lump, okay? So how to ask if we have one? For example, the patient presented to us with a bleeding. So please ask her about all others or all other red flag signs. The patient presented with a lump. So ask her about all others. So do you have any problem with your water work? No, doctor. With the bowel work? No. Do you have or do you notice any loss of weight? No, doctor. Loss of appetite? No. Do you have any bleeding? No. Any pain? No. Any lump? No. So here all the questions. But if you have one presentation, so you will not ask here again. So if we have bleeding, you will not ask about the bleeding here again. Already we will analyze in the history of the present illness. If you asked about the lump and pain in the history of the present illness, so just keep the red flag signs, urinary, bowel, loss of weight, loss of appetite. Some personal questions, and it's very important, like smoking, alcohol, using of recreational drugs. What about the BMI of the patient? What about the drug allergies? And here, drug allergies, it's a patient safety. So it's constant in all the modules, in all the stations. Don't ignore this question, please. Very important. Because here in hospitals in UK, it will be the first question. If you present it to the emergency or anything, it will be the first question. Do you have any drug allergies or any allergies? Very important question. BMI, what about the importance? You will know if this patient, for example, with postmenopausal bleeding and she's obese, so you will suspect more endometrial hyperplasia and endometrial cancer, more in this patient if she's obese. And if she's obese and diabetic, you will suspect more and more. If you remember from part two risk factors here, if we can find the risk if we can find in the patient, the risk of the endometrial cancer will be higher. postmenopausal bleeding with obesity and diabetes. The risk, as I can remember, it was around 25%. So it's very important to ask about the BMI of the patient. Menstrual, if the patient still have periods. So what about the regularities or the regularity of the period, any heavy bleeding, intermenstrual bleeding, or postcoital bleeding? And if the patient still has periods, please ask about the contraception. What about the contraception? If the patient postmenopausal, so ask about the HRT. And why are we going to ask about HRT and contraception? Because if this patient will go for a surgery, we need to stop this 4 weeks before. It's a safety point here as well. Okay, so it's very important to ask about the HRT or any hormonal treatment, either contraception or HRT. Obstetric, have you ever been pregnant before? How many children? What about the mood of the delivery? What about the recovery after that? What about the importance of these questions here? Just to know if this patient, for example, has or had 3 cesarean section, 2 cesarean section, so you will suspect scar tissue. You have to tell her like this. So the risk of the surgery will be higher because you have 2 cesarean sections before or 3. So we will suspect more adhesions in the medical term or scar tissue inside your tummy and lower tummy. Okay. Gynecology. What about the discharge and cervical screening? It's vital here. Please don't ignore patient safety point. So at the start of your preparation, guys, and this is my advice, in each case, just enumerate the patient safety points. And don't forget that some points of the communication will be a safety. Some points of the history here, like allergy, cervical screening, will be a safety. Also, the management plan to give the suitable or the correct options for the patient, give her pros and cons of each option to help her to choose. It's a patient safety as well. Okay. After that, the last slide, usually you will find it like this in all the modules. Medical, surgical, family, sexual, mental, social. Is it important, all of them? Yes, all of them. Why? Medical history. Do you have any medical problem of concern? Are you on any regular medication? For the surgery, have you had any surgeries done in your tummy or down below before? Very important. For the family, yeah. Do you have any family history of concern? And please ask a specific question here. Do you have any family history of breast cancer? No, doctor. Ovarian cancer? No. Cancer of the womb? Bowel cancer? So we need to exclude other types of cancer here. It's very important for in the family history. Sexual, you will ask about this to know if the patient is still sexually active, this problem affecting her sexual life or not, and show empathy here. If you have any point affected, please say, oh, I'm so sorry about that. I know it's you are frustrated or it's a frustrating problem. Okay, so just show empathy with the patient. Mental, is it important? Yes. Now you will break the bad news if the patient doesn't know her condition and you're gonna tell her, I'm sorry, you have a cancer. So her mental health has to be assessed first. Like in the last 4 weeks, did you feel depressed, low, not interested to do your usual activities? Very important question. Then social, what about support at home? Very important because this patient will need a prolonged recovery. So she will need support at home. After asking all these questions, please don't forget to say, thank you for sharing this information with me. And ask the patient, do you want to add anything? Sometimes if you are a very good candidate and the role player can see that, and you forgot one question or you forgot to ask about one thing, she's going to say, yes, doctor, I delivered before. For example, you forgot the obstetric. I delivered before and the delivery was by cesarean section. Okay, so that's why this is the importance of asking, do you want to add anything? And also to show respect to the patient that, yeah, I can listen to you more and more. And please, guys, don't interrupt the patient. I know that in the exam, you will be under stress, under pressure. I want to finish in 10 minutes. There is no clock in front of me. But please don't interrupt the patient. Leave the patient to speak, because when the patient, she's speaking now or asking questions, these are marks. You will get marks for that. Just to listen to the patient carefully, address her concern, answering her questions. It's all questions and it's all marks you will get. After information gathering, we will go to the examination. I'd like to examine you in presence of chaperone after your permission. Is it okay? This line was for the online exam, so we can skip this here. So I'd like to examine you in presence of chaperone after your permission. Is it okay? Okay. Some of you will say, I will ask the nurse to measure your blood pressure, pulse. If you have time, yes, you can do that. If not, so just examination, okay? And that's it. Then thank you for your time. Now coming to your concern. So we will stop here. If it's just to explain the condition, explain like ovarian cyst, because it's like a benign ovarian lesion. So we can involve the ovarian cyst either in the oncology or general gynecology. So if it's like that, so just explain. For example, the ovarian cyst, it's a fluid filling space. So how to explain it very simply to the patient? Sometimes the egg not released from your ovary, or the egg basket, if you want to give it another name or layman language. But the ovary itself, it's a layman language. The patient, all the patient here, they know what is the ovary, okay? So when the egg not released from your ovary, it will form a sac. And the fluids will start to accumulate or increase in size this sac, forming a cyst, which is a fluid-filled space. If we have a breaking bad news, now the patient has pre-malignant or a malignancy. She has a cancer. Please give 2 signposts for that. First signpost and then second signpost. The first one will be, I see that you are here today alone. Do you want someone to be with you? No, doctor, please go ahead. I'm so sorry. I think I don't have a good news for you. Okay? And usually they like to say, I don't have a good news. Don't say, I have a bad news. No. I think I don't have a good news for you. I have here your report after confirmation of your name, age, and NHS number, patient safety guides, to confirm that this report belongs to that patient. So please don't forget, make it constant. Once you will explain the report, make it like constant before explaining. And your report showing that you have a cancer. I'm so sorry about that. And stop. Some of you will say, you will discuss the cancer without mention the cancer like a word. No, please, just tell you have a cancer. You give her first signpost, second signpost. So don't turn around the report. Just say you have a cancer. I'm so sorry about that. Stop, leave the patient to absorb the shock. And if the patient will start to do eye contact with you or to speak, you have to speak. Don't continue in now coming to the management options. No, you will lose marks here because you have to respect this moment. The patient, she just knows that she has a cancer. So you have to stop, wait, ask the patient, are you okay? If the patient starts to cry, you can counsel her about, yeah, we can arrange another consultation. Is it okay for you, or shall we proceed? You can offer her tissue paper or a water, okay? Or a glass of water. So don't speak while the patient is in shock. If the patient starts to speak or to have eye contact with you, so ask her, are you okay to continue? Or we can arrange another consultation. Don't worry about that. And I will make it as soon as possible. No, please, doctor, continue, because we are in exams. In real life, yeah, the patient can say, yeah, doctor, I will go home and I will ask my partner to come with me or my sister or anything. But in exam, she's going to say, no, please, doctor, continue. So coming to the management plan, it will be different in each station. Don't forget the MDT. Here, it's mandatory because in all cancer patients, we have to involve the multidisciplinary team. In any other case, and this is my advice, involve group of expert team but it will not be the multidisciplinary team at that time. But for example, if we have a patient with any condition, like even patient in the early pregnancy, you have to involve your consultant, sonographer, if you will arrange ultrasound for her, and the nurse. Okay, if she will go for a surgery, laparoscopy, for example, management of ectopic, so anesthesia doctor or sleeping doctor, you have to involve like this, but it will not be multidisciplinary team, but her management has to be with a team. You got my point? Because no one will manage the patient like I will manage you alone by myself. No, it will not be like that. It has to be group of expert team. But in the oncology, it has to be multidisciplinary team. And discuss the multidisciplinary team with the patient, group of doctors or a group of expert team, or if you will mention doctors, so mention doctors, nurses, technicians, and pharmacists, or the doctors dealing with the medications. They will all sit together to discuss your case, your reports, all the investigations and imaging we will offer you, and they will offer you the best option. But you have to agree. So we will tell you all the options and you have to choose the best one or the suitable one for you. Is it okay? Okay, so this is how you will explain the multidisciplinary team to the patient. Don't forget a counselor. Here also it's mandatory. Sometimes even you will need a psychiatrist or psychologist, not only counselor, if the patient is severely affected. Don't forget to give the pros and cons of each option. Like we have the surgery, chemotherapy, radiotherapy. So the surgery, the pros and cons. These are the pros, the advantages, and these are the cons or disadvantages. Coming to the radiotherapy, the same, chemotherapy, the same. Then finish your station by saying, I know that I gave you a lot of information. I will provide you with this written information, or I will provide you, or I will give you patient information leaflet regarding what we have discussed today. I will arrange another appointment with my consultant. It will be as soon as possible. Usually, this is a fast track. It will be within 2 weeks. Even the multidisciplinary team has to be within 2 weeks. Okay, because it's a cancer patient. I will write back to your GP if you have a GP referral letter, or ignore it. Don't mention. If we are by the end of the management, yeah, you will give the patient discharge letter and one copy will go for the GP at that time. Okay, so fix another appointment, support group GP if you have GP referral letter, and give the patient information leaflet. And by the end, ask the patient if she has any other questions, any problem like that. And you will ask her during her management, during the counseling. Okay, and we will come to this point in the cases. Okay, guys, so this is the general template of the oncology. Do you have any questions? Any questions? Okay, thank you, my dear Reka. Thank you. Okay, guys, so we will start with cervical cancer. Let's have like 5 minutes, and then we will come back to discuss the cervical cancer, okay? 5 minutes break, and we will come back. Thank you so much. You are welcome, Dr. Noor. Thank you so much, my dear.